over 4 decades, the acquired immune deficiency syndrome, also known as AIDS, has ravaged the entire globe, taking millions of people to their early graves and bringing great negative impact to societies, whether in developed or developing countries. Just like the COVID-19 pandemic, the AIDS scourge led to a robust global response from the United Nations through its health establishment, the World Health Organization, making the world body to designate December 1st as World AIDS Day. Although significant progress has been made in the search for its cure in over 40 years of its existence, the disease yet remains a global health crisis which continues to generate its fair share of worry among policymakers, health experts and paramedicals, the pharmaceutical industry, national and state governments, victims and citizens all together. So, the essence of setting a day aside to commemorate issues of topical relevance such as these is meant to serve the purpose of public enlightenment and awareness creation with a view to reaching out and intensifying awareness campaigns to all and sundry that the reality is still with us. This is why the state government joined governments and non-governmental organizations all around the world to once again commemorate World AIDS Day on the 1st of December 2021. The theme for this year's commemoration is End Inequalities, End AIDS, End Pandemic, with the World Health Organization and its partners highlighting the growing inequalities and access to essential HIV services. The event, which was coordinated by the State Agency for the Control of AIDS, saw the agency's Executive Secretary, Kehinde Fatungashe, leading officials of the agency, development partners, members of AIDS support groups, among others, through the streets of Abeokuta, the Ogun State capital, to remind the general public on the need to stay on their guard, given that, among others, the symptoms of the virus still remains incurable. Additionally, there was free HIV counseling and testing for interested citizens during the march.
On December 1st every year, we celebrate the World AIDS Day to commemorate a global World AIDS Day activity in remembrance of those that have passed through to HIV and also to give support to those that are still living with the virus, that they are not alone, that we are in the fight to end HIV and AIDS pandemic together. And this year, the theme for this year is End AIDS, End Pandemic, and End Inequalities. The essence of this theme is to address those that are left behind in the control of HIV and AIDS. We are celebrating the 40th year of HIV in the entire world. Based on the assessment, we realize that some people are being left behind in this fight to end HIV and AIDS. And the essence of this is for us to address this group and to let them understand that we solicit with them and we are in this fight together. And who are this group? This group are our key populations. They are those that we call MSM, men having sex with men, our PWID, people with injectable drugs, and our FSW, female sex workers. These happen to be the key populations where the outbreak of HIV started from. And since then, they have been neglected and they have not been taken care of. And that is the essence for the inequality. And we are using this year's celebration to address this inequality and to give them support that we are together.
One of those who participated in the march is BC Dedeke, a chief consultant pediatrician at the Federal Medical Center, Abeokuta, who sheds light on steps taken to reduce chances of HIVs in babies, one of the greatest concerns among those in the fight against the disease.
It is important that a mother knows her status, and it is better for her to know her status before she gets pregnant, because children can have HIV babies when the mother is pregnant, at the point of birth, or when the baby is breastfeeding. So it is very important that a woman knows her status before she gets pregnant, so that she does not transfer the virus to her baby while the baby is in the tummy. But it is also important that we have facilities for people to have their diagnosis made when they are doing antenatal care. A lot of people don't afford themselves this opportunity. When you screen as a pregnant mother, it gives you an opportunity to know your status and be alive to take care of your child so that you can be on drugs. The drug is free. Any woman that is brought to the hospital in labor or in pregnancy will have an emergency test done. And if that emergency test is positive, we start prevention from that moment. We put the woman on drug. We prevent the baby from having it by ensuring that the woman takes her drug very well. As soon as the baby is born, we classify the baby. Is he an high-risk baby or a low-risk baby? This kind of setting is likely to be high-risk. We put the child on drug. When the child has the drug, we prevent the child from having the infection. And we also ensure that she breastfeeds our baby only, not adding any other feed. And then we do the test at appropriate time.
Apart from babies, children are also vulnerable to HIV/AIDS, especially those whose parents are victims of the deadly disease. The chief consultant and the focal person for pediatric HIV/AIDS, Federal Medical Center, Abeokuta, Dr. Mojisola Ogundeyi, elaborates more on this.
There are two things that we do. Number one, the mother must first know her status. But some women, they don't know their status. Some of these children are brought to us when their mother is late, after the mother is dead. And we now do the test for the child, and the child is now positive. If the child is now positive, what do we need to do? Our aim now is that this disease, we don't want it to affect the child's growth. We don't want it to affect the child's social life. We don't want the child to affect the child's educational level. So we want to bring the virus level in that child to minimal bearers level. There are also drugs for children that are positive. So when they come to our clinic, we approach it in so many ways. Number one, we take care of their drugs. And what do? There are free drugs for these children to be taken to reduce the virus level into their level. Then we also have the nutritional support for them, because we know that when they have HIV, it's going to affect their growth. So we have nutritional support for them. We teach their caregiver what to do, what to give them, and what is available around them. So as these children are growing old, once they reach certain age, at around the age of 10 years, we want them to know their status so that they will not transmit this disease to their colleagues at school. Even at a younger age, we let them know. Don't share sharp objects. Don't use blade to sharpen your pencil and all the rest. We teach them, don't share brush, don't share sharp objects, but they can sit together. They can go to class together and all the rest. From the age of 10 years, we keep on counseling them. We educate them. Some of them are even here today that we know them, they've been diagnosed when they are babies, when they are less than 1 year. We have some of them, they are 20 years, 24 years. We have about 3 or 4 years. We have some of them there. We have some of them that even they are married and they have children that are HIV negative.
Meanwhile, a press conference had been organized by the State Agency for the Control of AIDS to intimate the world on efforts by the state government towards combating AIDS within the polity. Kehinde Fatungashe is the agency's executive secretary.
The epidemic not only affects the health of individuals, it also impacts on household. And that is why you said that if you are not infected, we are affected. It impacts on household, on our communities, and the development and economic growth of any nation. But there has been a lot of global commitments to stopping the new infection and ensuring that everyone with HIV have access to HIV treatment. Now, let's come back to our state, the gateway state. The first case of HIV and AIDS in Ogun State was reported in 1990. And 1999, when the first HIV and AIDS zero prevalence survey was done, then we had a prevalence of 2.5%. When you look at this slide critically, you will see that when we started, we were around 2.5%. And where are we now? We are 1.6%. And 2016, we were around 2.9%. And now we are around 1.6%. Although the national value is around 1.4%. But when you know where we are coming from, and you look at the graph critically, you will agree with me that is it going up or going down? Exactly. Our last figure was 2.9, and our figure at present is 1.6. And I know that a lot of things have been done between that time and now. that we can say that a matter of time, the prevalence will drop.
He also took questions on concerns raised by members of the press regarding the pandemic.
Having gone through your presentation, and you said that Osaka is working in rural areas, but I've read in reports that people from Benue State, that the HIV is very prevalent in that place. And I've seen the influx of these people from this part of the country into our rural areas. They are farmers. I've done pastoral work in the rural area, and I've seen them. And these people are promiscuous. Their population, what is your agency doing to monitor the influx of these people into the state?
What we do is that is what we call corridor screening. I know we normally do a lot between Lagos State and our state, especially our boundaries. We do regular screening, and they put facility around those areas where the positive cases are referred to for ART. Now, there is no way you can tell somebody not to move to one area. The best thing we can do is to hype our prevention activities. Our media in those communities, how to tell them how to spread it, how not to spread it.
As far as Abeokuta is concerned, we have a lot of hotels and brotels. Do you have any collaboration?
In terms of this brothel, I'm sure that as far as Saka is concerned and the state government is concerned, we will visit them on a regular basis. We put condoms in those places for free. And there are some of them in the support group. We have a support group. The positive clients among them in the support group, they serve as ambassador in spreading the message. There is no way we are going to be everywhere. Our population is expanding on a daily basis. But what we can do to make sure that prevalence is kept at a low level is to hype our media. Not only the electronic, not only the print, but the local one. When we have to sit down on the tree, call the community leaders, ring the bell, talk to our people. This is what we encourage our volunteers to do in most of these communities. It comes at a zero cost. Everything cannot be done with money. It comes at a zero cost.
During your presentation, you said you are engaging in aggressive testing of rural communities. I want to know specifically, sir, what is the capacity of this testing? That is, how many people do you test per month or per year?
Now, when we enter the community, you cannot force them to do it. You can only encourage them that we are not there, we are not here to harm you. We are here to help you. It's a matter of time. You see, it's a spectrum from active rejection to active participation. That spectrum involves a lot of orientation, reorientation. It involves a lot of talk. It's not that it just happened in a single day. So the peak of that spectrum is reinforcement. We don't have to go and sleep. We have to keep telling them over the time. In a matter of time, you don't need to spend so much effort in telling them what to do next. Because this is what they have been hearing over time, they get to do it.
The issue of TBA, how often do you meet with these birth attendants? How often?
Our TBAs, they are linked to our respective facilities in the different LGAs. It's not that we see them every day. We don't. But it's because they have been trained and they have their own clinic days for pregnant mothers. They will take HTS to them. They will test them. We have made them to understand that we are not here to take their job. We are here to make sure that everybody is fine. And as a matter of time, they are registered with the state government. They are registered. They have their association. And they now know that we are on the same page. Unlike before, they think we are coming to take their job away from them. Yes, that is active resistance. We are past that stage now. They now know that what we are doing is for their own good. Any positive cases, they call the LACA managers in their respective LGAs. They link them to facilities where they get the drugs.
Recently, in Ogun State, secondary school, the disturbing reports about young girls and young guys. So what are you doing so that they will not?
That secondary school is very, very disturbing. It is making us to wake up from our slumber. There is what we call family life education. We normally do it in secondary school before. FLHE. I'm sure most of us must have heard about FLHE. This is what we normally do before. But we have gone to sleep. We are meeting the Ministry of Education. They are part of our line ministries that we discussed. We are meeting them. We are sitting together and we are looking at how we can revitalize a lot of these programs that we are doing before.
Mrs. Ronke Adeoye, the Southwest Coordinator of the National Agency for the Control of AIDS, was on ground among other partners, and they charged the state government to strive to attain more successes in the struggle against the disease.
When you talk about ending inequality, a recent study that we had shows that transmission is still ongoing every minute, every second, especially among children, mother-to-child transmission. There was a study that was recently disseminated called the mode of transmission studies. It shows that the children are also, we are still having positive children born to positive mothers in our country. It also shows that there is a particular set of people called the key population, looking at female sex workers, men that have sex with men, people who inject drugs. So as Ogun states, what is our role? We need to begin to look at this set of people, this population. Where are they located? How can we make provision for them? How can we give them the kind of care that they need? In the first place, they need to know their status. So, and you know that the KP, or key population as they are called, are like a marginalized community because of the policy that we have in country. But how, if they are the ones driving our epidemic, what do we want to do as a state? Because I think it's important for Ogun State to look inward to see what exactly is driving the epidemic in this state. And also there's another set of population called the unmarried individual. This group are the adolescents and the youths. Where are they located? How can we properly situate them? What kind of intervention can we do to make sure that we target them and they reduce the risk of new infection? So I think, everyone is talking about achieving epidemic control right now. This is the last mile. And I'm speaking specifically to Ogun State now, that as a state, we need to take the bull by the horn. We know that finance is very key. So it's a call to the government to be on the driver's seat to make sure that funds is available for HIV intervention in the state. And if all of these is available, we can now cater for these marginalized population. And then we can now begin to talk about ending inequality and ending AIDS through sustainable financing.
One of the key areas I want to mention, which I would like the Ministry of Information and the press to help us with, is that one of the drivers of HIV/AIDS is stigma and discrimination. That is when we stigmatize those people living with HIV/AIDS. And when we do that, we drive the pandemic, the transmission to continue, because people are afraid to come out and therefore to continue the society spreading the virus. So we want to encourage people that we want stigmatization and discrimination to reduce or to stop completely in our state, because we already know the mode of transmission. So sitting near somebody, working with somebody with HIV will not transmit the virus. Also, we want to encourage our people, because now HIV/AIDS is now a chronic disease. And one of the problems with chronic disease is sustaining treatment. After some years, especially those people that are stable, don't treat, no symptoms, no ill health, it is now difficult for them to continue using their drugs, to continue coming to the clinic. And this is what's up in the children and adolescents. A child that is born with HIV/AIDS, when the child gets to 5, 6, 7 years old, we start wondering, why should I go to hospital? Why should I take drugs when my other mates in the class don't take drugs? So these are some of the challenges that we have to come to encourage these people and to still help them more in whichever way, information and even finance.
The network of people living with AIDS is a support group of survivors, and we caught up with some of their members.
I employ all the people in Ogun State, both women, men, children, and adolescents, that they should come out and do their tests to know their status, because this HIV is not killing. It's not a killable disease. Thank God that God make it easy for us, because since I've been using my drug, there's nothing happened to me. I'm well okay, and there's nothing happened.
Everybody should come out and do the test to know their own status at the Federal Medical Center, Diaba. That is where I'm taking my own drugs. Came there, whenever you go for the test, after the test, they put you on drugs, started using your drugs. It's free.
My advice to the people is that they should come outside and know your status. It's when you know your status, you know how heavy you are living. But without knowing your status, you can't know how good and how you are. So then after you are confirmed it, does not mean that it's death sentences for you. Being on drug will be looking fine and good.
As the global attention to HIV/AIDS is rekindled again, especially within the context of COVID-19, indigenes and residents alike will do well to continue to live their lives with some great degree of responsible action that will not put their health and wellness at risk, thereby leading to needless grief and loss of life, in addition to other socio-economic effects which will result as a consequence of acting contrary-wise. Since the Ogun State government, under the leadership of Prince Dapo Abiodun, continues to work hard fighting the disease, and health workers and caregivers are not resting on their oars, what is left is responsible action among everyone if the disease must be altered or the percentage per capita must be reduced drastically. Ìgbéga ìpínlẹ̀ Ògùn, Àjọṣewani.